This is the only tea in the world that can reduce your proteinuria by 36% and your creatinine levels by 18%. Today, I will show you how to gather the ingredients, how to prepare it, and what you can expect in terms of benefits from this powerful tea. If you have been following me here regularly, you may already know that I like to keep the number of herbal medicines I recommend to a minimum. I receive many comments asking me to talk about this new product or that new thing, but I usually don't talk about them. And the reason is very simple: most patients are already taking a large amount of medication from prescriptions. Additionally, we have to add vitamins. There are vitamins that kidney disease patients need to take, even if their diet is perfect. Then there are some supplements that are so beneficial that even doctors prescribe them, such as sodium bicarbonate and probiotics. This is really a large amount of medications and supplements, and it can create risks for unwanted interactions and side effects. So experimenting with herbs and supplements is not something I recommend for people with kidney disease. You can understand why I don't like to talk about herbal preparations or supplements that haven't been fully studied or are just trending products at the moment. But this herbal medicine is different. This is a remedy with a proven record. In China, dialysis is not the only therapy for kidney failure. They use this herbal medicine to prevent it. And indeed, it is effective. There are studies conducted using Western scientific methods to prove that China's approach to treating kidney disease is genuinely effective. In this study, stage 4 CKD patients reduced their creatinine levels by up to 18.3% in just 3 months, solely by using a tea similar to the one I will share with you today. In a review of 22 studies on it, nearly 1,000 CKD patients were found to have significantly reduced creatinine levels. Now, these patients did not stop dialysis and continued to follow the prescribed therapies for kidney disease. So just by adding a single herb to their regimen, these patients significantly reduced creatinine levels, proteinuria, as well as serum hemoglobin and albumin levels. This basically means a comprehensive improvement in kidney health and function. It also implies that this tea is safe and has no serious interactions with the most common prescription medications for kidney disease. I'm talking about cordyceps, one of the most powerful herbal medicines for kidney disease. Now, what not many people know about cordyceps is that its main benefit is not reducing creatinine levels. Cordyceps is extremely powerful when it comes to stopping proteinuria. Why is reducing proteinuria so important? If there is one thing that can make the difference between ending up on dialysis and reversing kidney disease, it is proteinuria levels. Proteinuria levels can actually tell you your future. The truth is, having a high abnormal level of protein in your urine means your kidney function will quickly deteriorate. And while for those who are not diagnosed with kidney disease, seeing foamy urine means their kidneys are actually being damaged, the best nephrologists actually use protein levels to predict whether a kidney patient will experience kidney failure in the near future. This level is even more important than GFR or creatinine when analyzing your results. So, next time you get your kidney function checked, pay special attention to your ACR and protein levels, regardless of which stage of CKD you are in. So the next question is, should you take cordyceps in capsule form or buy it dried and make tea? Both forms have their own advantages and disadvantages. Cordyceps extract can be processed to ensure a certain amount of cordycepin, the most potent active ingredient in this mushroom. This is important because in one of the most comprehensive studies on cordyceps for CKD, researchers were able to isolate which components of cordyceps can treat kidney issues, namely, cordycepin. So, if you want to buy cordyceps in extract form, make sure the manufacturer can certify the cordycepin content. On the other hand, there's more to cordyceps than just cordycepin. Research has shown that Cordyceps militaris contains up to 35% beta-glucans. Now, beta-glucans are fantastic. Beta-glucans are soluble fibers derived from the cell walls of certain bacteria, fungi, and yeast. They have several excellent properties for heart health and can also reduce cholesterol absorption. In addition to beta-glucans, Cordyceps militaris, in its late growth stage, when it forms and disperses spores, develops very unique and powerful compounds like adenosine, cordycepin, and vitamin B12. All of these compounds have unique properties, and vitamin B12 alone may be worth the extra time to make tea. So, to summarize, there are many medicinal compounds in dried cordyceps that are really good for us and are part of the reason why this mushroom is so great for kidney health. Let's take a look at the science of brewing cordyceps tea. Now, how do we get the most out of them? The key to a quality functional mushroom tea is proper preparation. Researchers at Bastyr University conducted experiments with cordyceps and found some very interesting results. They tested fresh versus dried mushrooms, they tested water temperature, and they tested brewing time. So what we are going to see next is how to make the perfect cordyceps tea, scientifically proven. First, we need 250 milliliters of water, that's about 1 cup. And we also want to use 5 or 6 mushroom stalks. This is the perfect ratio according to scientists at Bastyr University. And I really trust the research they do there because, as you may know if you follow my videos, Bastyr University is the most prestigious natural medicine university in the world. In my recent video, I talked about its founder, Dr. Joseph Pizzorno, who shared his strategy for preventing kidney disease progression. So, what we want to do is put 5 to 6 mushroom stalks into 250 milliliters of water. Keep the cordyceps stalks boiling in the water for 1 minute. Now, after 1 minute of a strong boil, turn the heat to the lowest setting. Cover the pot and let it simmer for another 15 minutes. Studies have concluded that it is best to brew dried mushrooms for 15 minutes with the lid on. A longer steeping time will degrade the compounds, and a shorter time will not extract enough. This amount will make about 1 8-ounce cup of tea, but you can be flexible with the water volume and increase it if you like. Enjoy your fresh cordyceps tea, ideally after breakfast and lunch. And remember, never throw away the mushroom stalks. Eat them or add them to your meals or soups because they are rich in vitamins and nutrients, great for a kidney-friendly diet. In this study, the addition of 2 micrograms of this vitamin led to a reduction in protein levels by up to 34% in just 24 hours. CKD patients were able to maintain the improvement throughout the study period. If there is one thing that can make a difference between ending up on dialysis and reversing kidney disease, it is proteinuria levels. Having abnormally high protein levels in urine means your kidney function will deteriorate rapidly. On the other hand, there is a vitamin that can naturally lower your protein levels, protect, and improve kidney health. This is why today I want to focus on the most important vitamin for kidney health. Bringing this vitamin level back into balance can mean delaying dialysis for decades in some cases. This is vitamin D. We know that vitamin D is more important for kidney health today than we ever imagined. The rate of low vitamin D levels in people with kidney problems is extremely high. Around 90% of kidney patients have low levels of this vitamin, and that is a problem. Vitamin D supports normal kidney function, but it also supports immune function, respiratory function, bone health, and more. However, deficiency is extremely common. The kidneys are the organs responsible for converting vitamin D into its active form. And while vitamin D supplements can help, this vitamin comes with a warning. When taken alone, vitamin D can cause calcium buildup in the arteries, which is certainly not what you want. But if you take this vitamin in combination with a key mineral and a supporting vitamin, it can change your life because now you will feel energized throughout the day, and all the excess calcium that this vitamin allows your body to use will go straight to your bones rather than your arteries. Today, we will look at exactly how to do this. What happens to the kidneys when vitamin D levels return to normal? Vitamin D directly protects the kidneys. It reduces inflammation, fibrosis, and helps balance calcium and phosphorus. This happens because vitamin D deficiency causes inappropriate activation of the renin-angiotensin-aldosterone system. It directly causes kidney and heart damage, as well as high blood pressure. You may have heard of the renin-angiotensin-aldosterone system because that's what you regulate when you take ACE inhibitors or ARBs. These are the most commonly prescribed blood pressure medications for people with CKD, and they all target the renin-angiotensin-aldosterone system. Vitamin D does the same thing but in a natural way. That's how it protects you from proteinuria. And this also means that when vitamin D levels are low, medications like ACE inhibitors and ARBs do not work as they should, and kidney damage occurs. This is why ensuring the right vitamin D levels is so important if you are taking blood pressure medication. So how do I know if my vitamin D levels are low? Fatigue, joint pain, bone pain, back pain, and muscle pain, as well as hair loss, are very common symptoms of vitamin D deficiency. Vitamin D is also essential for the immune system. So frequent illness or infections and poor wound healing are listed as symptoms, as well as low mood and, in some cases, depression. Now, if vitamin D levels drop too low and there is a true deficiency, cardiovascular, autoimmune, and neurological diseases can occur. And while these are uncommon, patients are often treated for vitamin D deficiency when they have a history of fractures. Now, kidney disease itself is a risk factor for vitamin D deficiency. So, don't wait until something happens. My advice here is to get regular blood tests to assess vitamin D deficiency if you have kidney disease. Can vitamin D levels be improved through diet? Eating vitamin D-rich foods is not easy for people with kidney problems. There are a few food options we can consider. Milk and cheese are good sources of vitamin D, but they are often restricted in kidney diets due to their phosphorus content. Fish, including some types like herring and sardines, as well as eggs, are good sources. These foods are often restricted in kidney diets due to their protein content. They can be good for those on dialysis and for those in the early stages of CKD. Now, one food you can actually eat and that is rich in vitamin D is shiitake mushrooms. My advice here is to look for sun-dried shiitake mushrooms. These mushrooms directly absorb vitamin D from sunlight, just like our skin. Should you take vitamin D supplements if you have kidney disease? Since it is very difficult to get enough vitamin D from diet, most kidney patients are usually advised to take 600 IU to 2000 IU of vitamin D3 per day. Regular blood tests to check vitamin D levels will help your doctor determine the perfect dosage. But very few CKD patients do not need vitamin D. So, consider supplementation in any case. Is it safe to take vitamin D supplements alone? Vitamin D at recommended doses for most CKD patients should not be taken alone. Magnesium and, even more importantly, vitamin K2 are necessary for it to be safe and effective. Magnesium is needed for vitamin D metabolism. This mineral can become depleted when supplementing with vitamin D, leading to high blood pressure. According to recent studies, taking 300 to 400 milligrams of magnesium oxide daily is the best way to keep this mineral within the correct range. But while you should always take vitamin D in the morning, I recommend taking magnesium in the evening, as it helps you sleep better. Magnesium is not something we should take lightly. Keeping this level in the correct range can make a big difference for people with kidney problems. And never take vitamin D without vitamin K2. Vitamin D transports calcium from your diet throughout your body. Vitamin K2 helps ensure that calcium goes to the right place, absorbed by your bones. Which type of vitamin D supplement should you take? There are many supplements available on the market, but not many of them are designed with the needs of people with kidney problems in mind. Robert, the owner of this brand, is a kidney disease patient and an internationally recognized kidney health expert. He has helped thousands of people take better care of their kidneys thanks to products like this one. This is why Kidney D also comes with vitamin K2 in the right dosage, which is essential when taking vitamin D. And as always, consult with your doctor if you plan to start any vitamin supplement or if you believe you need to change your dosage. This is especially important because, in some cases, taking vitamin D supplements may not be enough to bring your serum levels back to normal. What if vitamin D3 supplements are not enough? Unfortunately, for some patients, regular vitamin D3 supplements are not enough, even those made to high standards and with the right dosage. This happens because the kidneys are responsible for converting vitamin D into the active form needed by the body. And in some cases, especially in patients in advanced stages, the kidneys cannot activate enough vitamin D. Now, if this is your case, don't worry. Nowadays, there are activated forms of vitamin D available that your doctor can prescribe for you. I'm not talking about vitamin D3, I'm referring to medications known as vitamin D analogs. These include calcitriol, paracalcitol, and many others. The right type of vitamin D analog depends on your serum levels and your thyroid hormone levels. Blood tests are necessary for your doctor to provide the correct prescription if you need a vitamin D analog. Remember, addressing this very common deficiency is key to improving kidney health.